And if they see a lesion, like a precancerous lesion or some inflamed tissue, they'll do a biopsy and then look at that under a microscope. Sometimes they'll do a barium swallow, which is where you ingest this really, has anybody ever done a barium study? You ingest this chalky liquid, which will show up on an x-ray. And then you can see what the whole esophagus looks like on an x-ray. And it's a video, a fluoroscopy, a video x-ray. So you can see the fluid moving down your throat. You can see if the muscles that are involved in swallowing and pushing the food through your esophagus toward the stomach is working properly. They can also do a pH test. So if there's acid leaking up into your esophagus, acid is a low pH. 7 is neutral. Water is pH of 7. Anything acidic is going to be below 7. Anything alkaline is going to be above 7. So soap and a lot of cleaners are alkaline. Anything acidic is going to be a lower pH. And they can do a pH test by threading a catheter, a tube, with a pH monitor down your throat. That's the way they've been doing it for a long time. Or more recently, they have these wireless little things that you can swallow, kind of like a little pill that you can swallow, that can communicate with a sensor on your skin, and then eventually it dissolves and it goes out through your digestive tract. So they can measure if there's acid leaking up in your stomach, because it will make the pH of the fluid in your esophagus lower. Most of the time, you don't really need to do any of those things. If you feel heartburn, there's a pretty good chance you have acid reflux. The reason you need to do these tests is if it's getting bad enough that you suspect. Well, so people that on a later slide, I'm going to tell you about who actually needs to take acid blocking drugs. Most people do not need to take Prilosec or Tums or Tagamet. There are other ways to naturally get your body to stop leaking acid up into your esophagus where it doesn't belong, because you want your stomach to be a boiling cauldron of strong acid. You need acid in your stomach. Acid in your stomach is your first line of defense against any kind of bug getting into your digestive tract. So any kind of bad bacteria getting into your colon. There's bacteria in all the food we eat all the time. And most of that gets killed off by the acid in your stomach. If two people go out to the same fish restaurant and one of them gets sick and is throwing up, and the other one who ate the same thing isn't getting sick, it can be a numbers game. If you eat a bad piece of food and it has a lot of bacteria in it, it's harder to kill off. But most of the time, if two people are eating the same thing, it's because one has sufficient acid in their stomach to kill off the bacteria before they can cause a problem, and the other one doesn't. So while we're on that subject, anytime you start to feel, or anyone you know, your loved ones, anyone who starts to feel like they ate something bad, they start to feel a little nauseous, a little queasy. Anytime you feel that and you have eaten recently, immediately drink vinegar. What kind of vinegar? Any kind of vinegar, it doesn't matter. Apple cider vinegar and balsamic vinegar are the easiest to swallow. They're least, irritating on the way down. If you have severe heartburn, you know it's going to hurt to drink vinegar, then you might not be able to do that. But if you don't have any recurring problems with acid, then anybody can drink vinegar. It's totally safe. It's not that strong of an acid. It might burn a little bit while it's going down, but then, that's temporary. And what that does is the acid will kill off the bacteria before they can make you sick. The bacteria, when you get food poisoning, it's not the bacteria itself that makes you sick. It's their metabolic waste. It's the wee from the bacteria that is like a toxic chemical. That's what makes you sick. So there's a little bit of a delay. When you swallow the bacteria, you start to feel a little queasy, but it takes an hour or two, or sometimes longer, before they multiply rapidly enough to produce bigger numbers of bacteria and then make enough metabolic waste to make you sick. So even if it's several hours later, if you wake up in the middle of the night after a bad meal, you can still drink some vinegar and it will often knock it down.
Pure?
Any kind of vinegar.
But not diluted?
So if it's hard for you to drink it straight, then yes, you can cut it 50-50 with water. It just doesn't work as good. So it just depends on if it's really bad, it will work better if you drink it straight. If it's not so bad and it's hard to drink straight, then cut it 50-50 with water.
If I do like apple cider vinegar and then a quick swig of apple juice to kind of settle it out, does that dilute the potency of the vinegar?
The apple juice will make, if your throat is already burning, then obviously it'll make it go down easier, and it will dilute the potency of the vinegar. Drinking water will dilute the potency of the vinegar.
Okay.
But if that's what it takes to get it down, that's okay. You have to drink a reasonable amount, like a couple of shot glasses, about 3 ounces at least, to have an effect.
That's a
That's not a small amount. Yeah. So
Just tastes bad for a half a second.
Yeah.
Okay.
exactly. And we're going to talk about some other things in a little bit that can coat and soothe your throat too. So a lot of people don't ever get any of these studies done. They just know they have heartburn based on symptoms, and that's okay. But this isn't. I've had hundreds of patients over the years that come in and say, "Oh, I have a hiatal hernia," and I'll ask them, "Okay, did they do an endoscopy or an X-ray? How did they diagnose that?" "Oh, no, my doctor just told me I have a hiatal hernia." Well, you have to have an X-ray or an endoscopy, either so you can see, because what is a hiatal hernia? There's three kinds of hernia. Hiatal hernia, the hiatus. Hiatus means an opening. So can you grab my pointer? It's on my desk, please. So the diaphragm is this dome-like muscle that's right below your lungs and your heart, right here, right? It goes like that, and your stomach is right underneath that. So the esophagus has to get through that, and it goes through a little opening in the diaphragm, and that opening is called the hiatus. And so a hiatal hernia means something pushing through an opening where it shouldn't be. And it doesn't look like she's finding that, so I'm going to grab it. It's here. It's on my desk. There we go. So here's the diaphragm. This is the hiatus, where the esophagus pushes through into the stomach through the esophagus. And so a hiatal hernia means that little tube right where it connects to the stomach is pushing up through the diaphragm, and then it usually bulges out. That's a hiatal hernia. To diagnose that, you have to be able to see that on an X-ray or a fluoroscope, or with an endoscopy with a camera going down your throat. They can see it that way. If you haven't had either one of those studies, then there's no way to diagnose a hiatal hernia. So I hear that all the time. People just get told that they have that because they have heartburn, or if they're especially if they're overweight. If they're overweight, and they just assume that it's your body weight, it's pushing your stomach up too high, and that's what's causing it. That is, I would say, at least 80% of the time when patients have come in and told me that they have a hiatal hernia, and I've asked them if they haven't had one of these studies done, they don't have a hiatal hernia. They just have a lack of the ability of that sphincter to close, which is what we're going to talk about next. So this talk started out as a quiz. So we're going to do, well, before we get to the quiz, how do you reduce it? If you get diagnosed with acid reflux, GERD, hiatal hernia, what are they going to tell you? Stop smoking. Smokers are always going to make it worse. The chemicals in cigarettes erode and inflame the esophagus and can cause heartburn even without any acid leaking up into your stomach. Alcohol does the same thing. If you drink too much of it, it can erode the mucosa. Your stomach has mucosa in it, mucus producing cells. How does that happen, right? Your acid in your stomach can cause an ulcer. It can burn through your skin. So your body protects itself because it's got a whole bunch of it's got acid producing cells and mucus producing cells right next to each other. And it makes more mucus than it does acid. It makes enough mucus to keep the acid from burning the tissue. But if you make acid when you don't need it, because you also hear, "Oh, my stomach's making too much acid." No, it's not. You want your stomach can't make too much acid. You just don't want your acid to leak up into your esophagus. And if you have a lot of stress, your stomach can make acid when there's no food in your stomach. And so when there's no food in your stomach, then the mucosa slows production. And then if you suddenly have a stressor that increases the acid production, then you can temporarily have more acid than your mucus is going to be able to successfully prevent eroding your skin. So that's kind of like temporarily having too much acid. But it's a gross misstatement of the facts to say that you're having heartburn because your stomach's always producing, or most of the time producing, too much acid. So losing weight, if you're overweight, then having a large belly, especially when you lie down to go to sleep, can put pressure on the stomach and make it difficult, make it easier for acid to leak from your stomach up into your esophagus. And eating right before you go to bed is the best way to guarantee or increase your likelihood of having acid leak up into your esophagus. If you eat a huge meal, now your stomach is full, you're full. If you drink some alcohol with it, maybe, so everything is nice and relaxed, and then you lie down, and you've got this huge meal that's going to, especially if you eat a meal like steak and potatoes that takes a long time to digest, or any kind of beef and starch. That's filling up your stomach. You lie down, that's going to put pressure on the sphincter between your stomach and your esophagus. And if you're relaxed, just going to sleep is relaxing. It's more likely for that sphincter to relax and let a little bit of acid leak up in your stomach. And it's a little bit. How many people here have had heartburn ever? Yeah. It feels like a lot of acid, right? It feels like, oh my God, it's burning. It must be a geyser squirting up, tablespoons. It's a tiny little bit. It's a few drops. And those of you who have had heartburn, have you noticed that sometimes you eat the same thing and one day it hurts really bad and the next day it doesn't hurt at all, right? It comes and goes. Why is that? Because it never just starts one day. You don't just get acid. The first time you feel it isn't because you suddenly had acid leaking from your stomach that day. A little bit leaks over and over again, and eventually that erodes the mucosa in the esophagus. So if you have these little patches that don't have enough mucus covering them and you have a little bit of acid coming up, then it'll hit those patches and you feel the heartburn. If you don't have any acid coming up, you won't feel anything, but you can have a little bit of acid coming up, and if it doesn't hit those patches, or if a little mucus from the surrounding cells is covering them and protecting them, then you won't feel anything. The next day, the same amount of acid coming up from the same cause will hit one of those patches and you feel it. That's why it comes and goes all the time. Because you've just got these little patches that are eroded, and it takes time to heal and repair that, but they can be, when you keep the acid away from them long enough, a few weeks, then those will heal. The mucosa will heal. The mucosa will start to cover those cells long enough for them to heal and go back to normal tissue that's resilient. So yeah, avoiding their bedtime. These are the things that you commonly are told, and they're all good ideas, but usually people are told to do those things and take omeprazole and take Nexium or Prilosec or some kind of acid blocking drug with no attention paid to the reams of research, available research. Most medical doctors have access to this research that show, for example, Clostridium difficile is one of the worst infections you can get. Only a severe infection of C. diff usually only get in a hospital, and sometimes they have outbreaks of this in a hospital because of contamination somewhere. And there's robust studies that show your risk of C. diff or any other severe infection in the gut goes through the roof, dramatically increased risk if you're on any kind of acid blocking drug, because acid is your first line of defense. So now we're going to do the anatomy lesson. What is this structure in the circle? Anybody? The esophagus, right. And what is this? The liver, pancreas, spleen, stomach, exactly. And what is this in this circle? It's a sphincter. Oh, what's it called? The lower esophageal sphincter, right? Where's the upper esophageal sphincter? In the back of your throat. There's a sphincter at the top as well. In the back of your throat, you swallow food, it goes through that first sphincter, starts working its way down, and this is always closed. It's a circular muscle, just like the sphincter at the very end of the digestive tract. Anybody not know what I'm talking about, right? So the anus is always closed. The lower esophageal sphincter is always closed. You swallow a bolus. You swallow a bit of food. A bolus, technically, is the term for a chunk of chewed up food. It moves down the esophagus, hits that sphincter, and that opens, goes into your stomach, and closes again. It's just automatic. Opens, goes through, closes. So it's always closed, but it's not always closed as tight as it can be, right? So the anus is always closed. But if you're in a hurry and you're caught short and you're running towards the bathroom, you can close it down tighter, right? Same thing with this. The lower esophageal sphincter closes down tighter. Why would it close down tighter? To prevent acid from squirting up into your esophagus. So what triggers that to close down tight? Strong acid in the stomach. There are receptors in your stomach to perceive the presence of strong acid. When you eat anything that's difficult to digest, like a fatty meal or a lot of animal protein, especially beef, it's harder to digest, requires more acid. Your body knows that. It will send a signal to your brain that will come back down and trigger the parietal cells in the stomach that produce the hydrochloric acid. It's hydrochloric acid that your stomach makes, and it will make more of it when it knows that you need more of it. And that will also trigger at the same time a signal to cause that sphincter to lock down tight so that none of that acid will leak up into your esophagus. So what causes acid to leak up into the esophagus? A, B, C, or D? What do you think?
Your mother-in-law.
Spicy food? D, exactly. You can never have too much acid in your stomach as long as there's food in there. But if the sphincter, because if that sphincter is locked tight, that's the way it normally works. It's like that. But if it's open just a tiny bit and a little bit leaks up, then that is eventually going to cause those symptoms. So what triggers the sphincter to lock down, preventing reflux? Nexium? Protonics? Eating healthy food? None of those. Strong acid in your stomach triggers the sphincter to lock down tight. What does nothing to tighten your lower esophageal sphincter, but instead weakens the acid in your stomach? All of the above, all of the acid blocking drugs, right? All of the above, yeah. So it doesn't matter. Oh, there's 3 different classifications of antacids. There's the like Tums, the things that buffer the acid and just neutralize it. There's H2 blockers, and there are proton pump inhibitors. So most of the prescription drugs like Prevacid, omeprazole, those are proton pump. It doesn't matter. They all block acid. They all effectively reduce the acid in your stomach. And so for our purposes, they all do the same thing, which is never good. So significant deficiencies of which of the following nutrients are common in anyone that takes any of these drugs? Calcium, iron, magnesium, protein, vitamin B12, or all of the above? What do you think? All of the above. All of those, you will have significant deficiencies that will have health impacts of calcium, iron, magnesium, protein, B12, and other B vitamins and minerals when you take any acid blocking drug, because you need acid to effectively break down and assimilate those nutrients.
So those pills reduce the important elements that we should have.
Exactly.
Okay.
Yeah, if you take any acid blocking drug, if you take Prilosec, Prevacid, omeprazole, you're going to be more likely to have osteoporosis because of the calcium deficiency. You're going to be more likely to have anemia. A lot of times when I see people who have anemia on their blood test, I ask them if they're taking any acid blocking drugs because that will cause it. When you're low in stomach acid, it will also cause your protein level to be low on a blood test, and usually several of your minerals, magnesium, calcium. Um, there's on a typical metabolic panel, or a complete metabolic panel will test calcium, magnesium, sodium, chloride, phosphorus, and often several of them will be lower because it lowers to a certain extent all of your minerals, but especially iron, calcium, and magnesium. You have to have acid to break those down and absorb them. So even if you're getting plenty of them in the diet, it's really common to have people will come in and their protein level will be below 7. The healthy range for protein is a little bit different for men and women in different ages, but roughly some 7 point anything is usually a good level of protein for most people. And I often see it's 6.8 or 6.6 or 6.4 or 6. And why is that? I ask people, are you eating some eggs for breakfast and some chicken or fish or some other kind of protein? Or if they're vegan, are you eating a lot of nuts and seeds and whatever you do to get your protein, a protein shake of some kind? And a lot of times people will say yes, and it's still not sufficient in their bloodstream. How come? Because they don't have sufficient acid in their stomach. So you can be eating plenty of protein. You can be eating 2 eggs every day and a piece of chicken for lunch and a piece of fish for dinner every day and still be low in protein in your bloodstream, because especially if you're over 50, or everybody as they get older, your stomach tends to make less hydrochloric acid. And if you don't have the acid to break that protein down, you can be having a great diet and still not assimilating that protein. And therefore it's not helping you. Protein is the basic building block of every tissue. That's why it's so important. So increased risk of the following conditions is inevitable in anyone who's taking acid blocking drugs. Well, the calcium deficiency is going to cause osteoporosis. Calcium deficiency can actually affect muscles, can increase your risk of heart attacks, but so can deficiency of iron causing anemia, and magnesium making it difficult to relax when necessary. Same thing, all of those things previously mentioned can increase your risk of stroke. We talked about intestinal infection, so you guessed it, all of the above. So can most people get rid of acid reflux without taking acid blocking drugs? What do you think?
That's why we're here.
Yeah.
Absolutely. So how do we do that? Well, some people should take acid blocking drugs. Who? Well, if you have erosive esophagitis, what does that mean? That means inflammation in your esophagus that's eroding the mucosa and causing a lesion, causing some thinning. So you've got raw skin that's irritated because of a little bit of, not a lot, just a little bit of acid is squirting up there and irritating that over and over and over again repeatedly. That can increase your risk of cancer. Um, Peptic strictures, that means a narrowing of the esophagus, and beyond just that erosion of the mucosa, scar tissue can form, and that can actually narrow the esophagus and make it difficult to swallow. Even that's reversible. I've had several patients who had difficulty swallowing where they'd have to regurgitate their food, and I give them something called systemic enzymes, which help break down scar tissue. There's a product called nattocerezymes made by Designs for Health that I use, which is a combination of nattokinase and serrapeptase. These are systemic enzymes that your body uses to break down fibrin, which is the building block of all scar tissue. It works. I usually use it mainly for anyone who has arthritis, which is most people as you get older, and also anyone who wants to reduce their risk of heart disease, because nattokinase famously was discovered in Japan back in the 80s as responsible for, in large part, for their much lower risk of heart disease because they're consuming a fermented soy product called natto. Well, why don't we just eat natto? Because it has the consistency and odor of nasal mucus. It's a stringy, gooey porridge. It's disgusting. No American's going to eat it, but in Japan, they give this porridge to their children at an early age and they get used to it. So I have a cousin in LA who's an actor and he married a Japanese woman. So I tasted it one time. It wasn't quite as bad as I described, but yeah, I can't imagine eating it every day. But it is the source of nattokinase, the systemic enzyme that reverses arteriosclerosis. It breaks down the scar tissue that's forming in your blood vessels that creates the plaques. And vitamin K2. Vitamin K2 also does that, and vitamin K2 also only comes from natto. Vitamin K1 is in all the dark green leafy vegetables, broccoli, spinach, kale. But K2, there's tiny amounts of K2 in other foods, but the only really robust source of it and the source of all the K2 supplements is from natto as well. So Barrett's esophagus is when one of the two above gets to the point where it's precancerous. That's when they do an endoscopy and they see that signs of inflammation. They'll do a little biopsy, look at that tissue under a microscope, and see precancerous changes or cancer. They look different. They can often catch it when it's precancerous. That just means that some of the cells are starting to look different than their neighbors and dividing faster than they should. When they continue to do that, it can become cancerous. So that's the main reason to take acid blocking drugs is if you have any of those conditions, you want to make sure you don't get cancer of the esophagus. But most people can reverse that reflux and stop that by avoiding eating near bedtime, but for 4 hours. So in the beginning, I said lots of doctors will tell people, oh, don't eat right before bed. Well, people think, okay, so I'll wait a half hour after I eat. No, 4 hours. If people who already have acid reflux, if they start, and they haven't been doing this already, if they start waiting 4 hours, so finish your last bite of food. If you finish your last bite of food at 7, then don't lie down until 11.
That's because it's digesting and it's helping break it down before you get horizontal.
Exactly.
Okay.
Yeah, you want to give your stomach time to start breaking down. So it also depends on what you're eating. But if you've tried it before and it's not working because you've only tried it for an hour, try it for 4 hours. So if you just have an apple before you go to bed, you're probably fine to lay down immediately. But if you're having a typical dinner, what most Americans eat for dinner, some kind of meat and starch together, and their biggest meal, most people, we all eat our biggest meal at dinner, right? And that makes no sense physiologically. It makes sense for our schedules, right? Most people historically worked all day and then they come home and that's when they have time to eat their biggest meal. And we want to gather our family around and have a shared meal together. That's important. But we don't need food to sleep. We need calories and protein during the day when we're awake. And you want to have all that stuff digested hours before you lie down so it's completely broken down and not just broken down and in your intestines, but broken down, moving through your intestines, already all those nutrients already in your bloodstream when you're asleep, because that's when healing and repair occurs. That's when you need the nutrients in your bloodstream, not still waiting in your stomach to be broken down. Also, if you have difficulty sleeping, digestion requires a lot of energy. So if you're laying down horizontal with a full belly of food that takes several hours to digest, that's going to interfere with your sleep. So some people who have had people who come to me who've had GERD for a long time, and I tell them you want to get off the omeprazole, etc. Sleeping incline can help. Sleeping in a recliner, or you can get these high density foam wedges that you can put in your bed to sleep on a slight incline, and they come in all sizes. You might just need to sleep with your head 4 inches higher than your waist, or 12 inches higher. They come in. You can buy them on Amazon. They come in different sizes because it's ideally you don't have to do that forever, but you can get one that's just high enough to do the job. And then after 3-4 months, if you remove that constant source of excess acid, just a tiny amount squirting into your esophagus, that tissue will heal. And then eventually you can strengthen that muscle so it stops leaking over and over again. So not eating a huge meal, not being overweight, not lying down right after you eat your last meal at night can take the pressure off, and eventually that muscle can get stronger. You can even test this, and I haven't done this with a lot of patients. Well, there's a couple of things. So if you actually do have a hiatal hernia, is there any more? Yeah, this last slide. So if your stomach is really pushing up through your diaphragm, the reason that's a problem is because, where's my picture with that hiatal hernia? Yeah. So the reason that's a problem is because even if that just pushes up a little bit before it even bulges out like that, the sphincter, the lower esophageal sphincter, is just below the diaphragm, right? The food comes down through, and so if it pushes up, then it's stretching the muscles around that, and it interferes with that ability of that muscle to open and close properly. So there's actually an adjustment. We call it an adjustment. It's not cracking your neck or your back or anything, but I can physically, when you're lying down on the table, I can dig into your belly and get a purchase on the stomach and pull it down. It's not comfortable, but it works a lot of the time. Not every time, but a lot of the time I can just physically pull the stomach down. Have you take a deep breath in, pull it down. I do it 3 times. Usually you'll feel a difference immediately. Sometimes I have to repeat that a couple of times. Oftentimes that will work. It will get you long-term relief for months, maybe before it comes back, or sometimes forever. Beyond that, and I can't do this with everybody. If somebody has arthritis in their knee or their hips, I can't have them do this. Every situation is different, but if I evaluate someone and I suspect that they can tolerate it, another thing you can do is drink as much water as you can. Ideally, about a quart or some large, whatever amount you can get down quickly. Fill your stomach with water, and then stand on one stair or something, a stool, something just a few inches above the floor. All right, so you got your stomach full of water now, and a stomach full of water is heavy. Then you jump down, and it yanks the stomach back down. That also works. Not everybody can do that, but a lot of people can, and that's amazing. If you really do have a hiatal hernia, to jerk it back down. Then even better than that, you can strengthen. So just doing all the things we just talked about, not losing weight to take the pressure off, stopping all the things that cause the muscle to relax when it's got a lot of pressure on it, can actually give it the chance to strengthen over time. It will automatically, tend to, unless you're like 80 years old or something. If you're not too old, and it hasn't been going on, if you haven't had GERD for years, then the muscle will tend to strengthen over time if you've got adequate protein in your diet. There's some other things that can interfere with it. Even just having a subluxation or pressure on the nerves in your back, the nerves that control the esophagus, can be interfered with by pressure in your back. All of those things contribute to it, but eventually you can hang upside down. You can drink that same water and then hang upside down. Shall I show you how to hang upside down? Imagine filling your stomach with water and then hang like this. Now that water is pushing on that esophageal sphincter, exercising that muscle. You can exercise any muscle, right? So that's a way to exercise that muscle and make it stronger. So I've had people do that too. Now we know it's strong and it's not going to leak. Any questions? All right, for the first time, we've finished in a half hour. Yay. Sometimes I get talking for so long, and as long as you're still paying attention and nodding, and I just keep going. So